Hi guys, so today we're going to talk about 11 reasons to practice safe sex. Safe sex means that every time you have sexual intercourse, which includes any form of sharing your body fluids, oral sex, vaginal sex, anal sex, you use a condom every single time. Or you don't engage in these activities. Maybe you just kiss or touch each other, or maybe you only masturbate. If you're gonna have oral sex, vaginal sex, or anal sex, you have to use a condom every time. Most important reason why you should practice safe sex is to avoid sexually transmitted infections. The more common ones for younger girls in the US are gonorrhea and chlamydia. The other ones that we also worry about, of course, are HIV, herpes, syphilis, hepatitis B, hepatitis C, and HPV. If you have any of these infections, you want to get treated right away. A lot of these don't cause any symptoms, so it's important for you to go see your gynecologist once a year, and we will screen you. If you're at high risk for sexually transmitted infections, we will screen you for them because sometimes you won't have any symptoms. We consider everyone 25 and younger to be high risk for sexually transmitted infections just because younger girls tend to get infections more common than older ladies. That being said, if you are over the age of 25 and you know that you have more than one partner, or maybe in the last year you've had more than one partner, or maybe you engage in drug use or activities where you might be at risk, then certainly tell your doctor, and we're happy to send tests for these infections. Okay, so another really good reason to use condoms or practice safe sex is to avoid an unwanted pregnancy. Half of pregnancies are unplanned, unwanted pregnancies. So if you're using a condom to protect against infections, it's also going to protect you against pregnancy. So it's a perfect way to protect yourself against unwanted pregnancy. A third reason is to avoid side effects of infections that can cause infertility. A lot of times, since infections go unnoticed, or if you don't go to see your doctor, get screened, maybe you don't have discharge, or maybe you had a little bit of discharge that you thought was weird and then you felt it went away on its own and you were never treated. A lot of these infections will move up into your fallopian tubes, and then it'll cause scarring, or it'll cause an abscess, or it'll cause a problem where your tubes don't function properly anymore, and then it leads to infertility, and then you'll have a problem getting pregnant. So you don't know about this until years have passed and you're trying to get pregnant, and then we go do an ultrasound, and then you have your tubes are swollen, or you have some scarring of some sort. Make sure you're seeing your gynecologist regularly and that you're practicing safe sex. So another side effect of infections is that they can cause ectopic pregnancy. Instead of implanting in the uterus where it should be, they will implant or get stuck in the tube. So when a pregnancy is outside of the normal place where it should be, we call it an ectopic pregnancy. And these pregnancies are very dangerous because if it's in the tube can only stretch so much. So when it reaches the maximum point where it can stretch, it'll rupture and women can bleed to death. So this is a very serious consequence of not practicing safe sex. If you have an ectopic pregnancy or a pregnancy outside of your uterus, those sometimes cause so much bleeding suddenly that you can lose so much blood that you can die. So this is really important to try to always use a condom so you don't have an ectopic pregnancy. Another consequence of pelvic infections is a disease we call pelvic inflammatory disease, or PID. This is a very common problem that young girls have. It's just pelvic pain, and sometimes you have other problems like yellow or purulent discharge. You might have very tender, painful cervix when we go to do an exam for you. You might have fever, just signs of an infection. So PID is thought to arise from a pelvic infection from not practicing safe sex. Another long-term effect of an infection can be chronic pain. A lot of women have just chronic pain. They're always having pelvic pain. It could be that you had an infection from not using a condom and it's just lingering there and you don't really have any other symptoms besides the pain. That also can be avoided just by practicing safe sex. The seventh reason is to try to avoid an abscess in your vulva or in your pelvic area. There's these glands that cause lubrication in your vulvar area, like by the opening of the vagina, and these glands sometimes, if you have an infection, they can get clogged and it forms like a golf-sized abscess. It's very tender and it feels like a ball, a hard ball, and it's under pressure. If you try to squeeze it, it hurts a lot. This is also thought to be from an infection, so by practicing safe sex, you can try to avoid these. By using condoms, you can try to avoid getting HPV. Also, of course, you should get your Gardasil vaccine to be protected against HPV if you're under the age of 26. HPV increases your risk of cervical cancer. By practicing safe sex, you can prevent cervical cancer, so always use a condom. If you have an active herpes lesion and if you're pregnant, you would need a C-section. Just by practicing safe sex and not getting herpes, you can avoid a C-section. If you have really large genital warts that can either obstruct the passage of the baby, or if they're bleeding, that can cause the baby to be infected, we wouldn't want you to have a vaginal delivery at that point, so then we would recommend a C-section. One very rare but also very important infection that can go unnoticed is syphilis. So when we don't catch syphilis right away, you can develop secondary or tertiary syphilis, they call it, second stage or third stage syphilis. And these have really bad consequences like a rash. It can affect your brain, it can affect your heart, and if you're pregnant, it can affect your baby. So it's very important to try to avoid these infections. Lastly, if you're pregnant, you definitely want to practice safe sex if you're not in a committed, stable relationship. You always want to use a condom, because if you get an infection, your baby can be at risk. Depending on how far along you are in the pregnancy, it can cause a miscarriage. It can cause you to break your water too early before the baby is ready. It can cause you to have preterm contractions or preterm labor and deliver early, which can have really bad consequences for your baby. There are some infections that can also, like at the time of birth, the baby can get infected and it can give the baby eye infections or pneumonia. So it's just really important to try to avoid an infection at all costs when you're pregnant. So you always want to use a condom. These are 11 reasons why you should practice safe sex. Remember to always use a condom if you're going to engage in sexual activities, or not engage in sexual activities. You don't have oral sex, vaginal sex, or anal sex if you don't have a condom. All right, you guys, so like the video, subscribe to our channel, send me any questions to gynogal@gmail.com, and like us on Facebook, and I'll see you next week. Run into patients that have never visited a gynecologist until they're pregnant. One of the first reasons to go see your OBGYN, of course, would be to start prenatal care, because you just found out you're pregnant, or your period is late and you think you might be pregnant. That's the perfect reason to make an appointment with your OBGYN. Maybe you're not